umaga mga kasambahay! Ito ang programang Doctors on TV, tagapaghatid ng impormasyong pangkalusugan. And I'm your host, Dr. Sara Barba Cabodil. And for this wonderful day, I'm always grateful to God for granting me the opportunity to share a wellness tip that could benefit your day. And moving forward mga kasambahay, para sa araw na ito ay pag-uusapan natin ang tungkol sa men's health. Marahil sa panahon natin ngayon, hindi tayo aware sa ganitong klase ng kondisyon sa mga kalalakihan. Ito po ay ang erectile dysfunction. At bago ko tawagin ang ating panauhin ngayong umaga, panoorin po muna natin ang paunang detalye.
Mga kasangbahay, ayon sa World Health Organization, ang sexual health ay isa sa pangunahing bahagi ng kabuuang pangkalusugan at well-being ng bawat individual. At isa sa problema ukol dito ay ang erectile dysfunction na milyon-milyon sa mga kalalakihan ang apektado nito sa buong mundo. Bukod dito, ang erectile dysfunction ay napag-aralan na ito ay ang pangunahing problema simula pa noong taong 1990. Dapat bang mabahala sa panahon natin ngayon ang mga kalalakihan pagdating sa usaping erectile dysfunction? Alamin ang kasagutan mula sa ating panauhin ngayong umaga.
At ngayong umaga, may makakasama po tayong panauhin upang ipaliwanag ng mas maayos ang mga detaling dapat nating malaman. He is recognized for his commitments to providing exceptional care to his patients and serving as a guide and educator on various urological conditions. Let us welcome Dr. Jaime Songco, a urologist from Makati Medical Center. Good morning, Doc Jimmy, and welcome back to Doctors on TV.
Good morning, Dr. Sara.
Yeah, and ako, ang saya natin dito dahil nakabalik po kayo at marami na naman kayong mai-impart sa ating mga viewers. You might want to greet our viewers muna, Doc Jimmy.
Good morning and thank you for inviting me again here. And happy to share with you whatever knowledge I can for enlightening your viewers, especially with this unique problem.
Yes, and ako, salamat ulit, Doc, ha. Yan. And ito po, para po sa ating pag-uumpisa, Doc Jimmy. Let's start with a question, kung dapat bang mabahala sa panahon natin ngayon ang mga kalalakihan pagdating sa usaping erectile dysfunction at saka bakit po?
Well, I think since time immemorial, the potency or yung ability ng lalaki magkaroon ng capacity sa pagtatalik, especially in a relationship, is very important, no? So I guess the ability to not only for procreation but to have sex is one of the major issues that keeps man moving.
Yeah, okay.
If I would say so, no, it's something that drives him, gives him the drive and libido to work, to be driven. So it's something very important. Whether it's nowadays or even before, I think it's very basic.
I agree with you that it encompasses a lot of things, hindi lamang dun sa activity, but of course may mga implications din siya. So, can you simplify what erectile dysfunction is?
Just to add on to what I said earlier, the advent of social media has heightened this problem. As you can see, maraming naglalagay sa Facebook ng mga gamot, you know, maraming ability to do this, do that, which I'm not really sure they're really working. But in plain essence, erectile dysfunction, ang ibig sabihin niya, the ability to attain and maintain erection sufficient for personal satisfaction and of the partner.
So it doesn't end dun sa lalaki lang basically.
Hindi, oo. So hindi to parang one-on-one lang, no? It has to be a relationship issue.
And of course, syempre affected dito yung buong pamilya also. Kasi kung dito magmumula din yung relationship, ng magka-partner.
Correct.
Okay. Correct. And ito ba may mga iba't ibang klase or are there different types of erectile dysfunction?
Yes. We probably will have to grade it in a simplified manner, no? Kasi mayroong classification talaga if you use the International Erectile Symptom Scoring, but actually you can just simplify into 4 grades, no? Grade 1 would be the siguradong pathologic because its grade 1 is like tofu or tokwa.
Tofu or tokwa? Bakit yung naihalin tulad sa tokwa, Doc?
It's so soft. Hindi ka whatever, wala talaga. It's flat, no? Number 2 is peeled banana. Meaning, yung saging pag binalatan mo, mukhang matigas pero pag tinusok mo, bali. Okay, so that's grade 2. Grade 3 is suboptimal erectile dysfunction, which maraming lalaki meron ito. Ito yung unpeeled banana. Matigas, but not enough. I mean, you know, it's hard, it can penetrate maybe, but you may not achieve the same kind of quality or climax that you and your partner will achieve.
It's not as sturdy kung normal.
Correct. Ang grade 4 ay yung sintigas ng pipino or zucchini, if I would say. So this is the normal one, and this one is really rigid and tough. Mahirap mong baliin. No? So something like that. So I would liken it to that grade. So our listeners or audience will appreciate. So we consider 1 and 2 as really pathologic. 3 is semi, and 4 is normal.
Okay, so Doc, basically pag dumadating sa inyo ang isang male patient, ano po yung most common na finding dun sa mga binigay niyong iba-ibang numbers?
Well, ngayon kasi, mas open na ang public sa problemang ito eh. Hindi kagaya noon, laging may hiya. There is this feeling of, you know, you're regarded as you're not sick, but something's wrong. And the frustration comes especially when there's pressure from the partner. So, ngayon, people are more open to it. Alam mo naman, nung nilaunch ang Viagra, 1990s pa eh.
Yeah.
So, 1997, if I'm not mistaken, Viagra, Cialis, Levitra all came into play, and then there was voodoo issues about it. But now, they're like, everybody just uses it. Matanda, bata. So, you can see that from the Massachusetts Male Aging Study, as early as 40 years old, meron ng erectile dysfunction yung iba, of different grades. Depende sa lifestyle, comorbid conditions, stress, alcohol, drugs, marami.
So it's multifactorial.
Multifactorial.
But you mentioned a while ago that the society is more open this time around,
Correct.
okay?
Correct.
Does it mean that a male individual who suffers from erectile dysfunction, when he comes into your clinic, I mean, he comes along with like his partner?
Sometimes yes, sometimes no.
But usually po ba pag na-mention ba nila if aware ang partner of their coming to your clinic?
Majority do, but some don't.
No, the reason why I asked, not for marites
Yeah.
purpose, is basically kasi this is a condition which, you know, entails a lot of understanding rather
Correct.
than parang pag-ukusa. So, mas gusto natin bigyan ng ng understanding yung mga may ganitong klase ng condition kasi sa iba madaling mag-comment, but however, sa may affected po ng ganito, syempre yung frustration sa part nila, and like what we mentioned a while ago na affected yung relationship, and then it
Yes.
boils down now to the relationship among the family members also. Hindi alam ng mga bata what's going on with their parents. Okay?
Correct.
And usually, so, mga kalalakihan po, may age bracket ba na affected dito?
Yeah. Ang napapansin ko, no, majority are those with comorbid conditions. Meaning, yung mga elderly na may diabetes, hypertension, maraming iniinom na gamot, obese. Ito yung mga majority may erectile dysfunction. You can already see when the patient goes to your clinic, fat, maraming gamot, siguradong may one form of erectile dysfunction ito. It varies from degree to degree. And in fact, I appreciate if the wife is along because
Yeah.
she can grade, she can tell. And there are some whose the wife is the one complaining.
But isn't it awkward naman po dun sa male patient during the discussion?
No. Maybe in my field, no? Kasi it's part of our history taking.
Yeah.
It's part of our therapeutic regimen to really find out the sexual history.
Yeah.
It's appropriate for me, no?
At saka para mas matulungan nyo din ang pasyente kung may
Exactly.
ibibigay kayong mga gamot, and then of course sa pagbalik ulit kung has there been improvement noticed, and
Correct.
para at least magkaroon din ng upscaling of the dosing.
Yes. Sa mga bata naman, you will notice yung mga bata na stressed from work into alcohol, drugs, lack of sleep, yan din, no? Kahit na nasa 40s pa lang, because of lowering of testosterone, from all these activities I mentioned, nagkakaroon din yan.
I see, but how young have you seen?
40s.
40s yun na talaga ang pinaka
Yeah.
Okay, and kasi especially iba na rin kasi ang lifestyle ng generation ngayon eh.
Yes.
I mean, the stress has been really going up, and
Yes.
syempre you would everybody needs to keep up dun sa stress nila I mean, depende kung kunyari it's a job requirement.
Exactly. Like the BPO business.
Yeah.
Yung mga call centers, di ba? Ang tulog nila umaga. The biorhythm has changed. And this will have an impact on your hormonal milieu. So, talagang magbabago. And then you can see in the morning, instead of kape, ininom nila alcohol.
Grabe, in the morning talaga,
Yeah,
Doc.
you will see them in the morning hanging out there, imbis na
kasi,
kape. Tayo nagkakape, sila matutulog eh.
Kasi yung mga night shift,
Correct.
sila patapos na yung araw nila as compared
Exactly.
sa atin na talagang ang working hours natin, yung regular, yung
Baliktad
normal na
sila
Yeah, okay. Well, that's sad kasi talagang naman you would have to live with dun sa schedule talaga na
Kaya yung nocturnal activity nila sa opisina,
so,
iba.
umaga ginagawa.
Yes.
Oh, okay.
So that explains ba't maraming may sakit doon, maraming may complaint na ganyan.
Yeah. But ito, Doc, kasi di ba we're talking about yung sa erectile dysfunction. So, basically, na-mention nyo kanina, parang bali or bumababa. So, basically, or walang capacity to erect, no? So, I mean, meron ba itong minsan na mga accompanying signs and symptoms apart from that? Pero ang diagnosis natin, I understand, yung pinaka-condition would be erectile dysfunction. Pero meron bang magli-lead na mga signs muna doon or symptoms na nararamdaman ng pasyente before siya ma-diagnose nito, bago siya makapunta sa inyo?
Alam mo, that's a very good question because if you look at the artery of the penis and the artery that supplies the heart, parehong size nila. So sometimes, if the patient is young or not that old at nagkakaroon na ng symptoms of erectile dysfunction, you must rule out heart issues also.
I see.
Kasi it can be a harbinger of heart disease.
Baka kaya, Doc, kasi diba, before, you mentioned some like brand names a while ago, yung mga gamot na isa sa mga pinakasikat, the one that starts with letter V, diba? Okay, and alam natin, it was just a coincidental, parang finding na nakakatulong siya for erectile dysfunction, but before, it was used for cardiovascular problem. Tama ba ako doon,
Tama.
Doc?
Tama.
Yeah, okay. So,
Tama.
that makes sense kasi sabi nyo nga, the diameter ng blood supply to the penis is of the same diameter dito sa sa mga
Coronaries.
coronary arteries.
Yes.
Okay. Okay. And so basically kailangan pareho talagang ini-investigate. So napaka-importante talaga ng proper complete clinical history taking.
Exactly.
Kaya dapat talaga iwasan natin yung minsan marami kasi nagse-self-diagnose, 'di ba, Doc, because
Yeah.
of the internet. Napakarami kasi information.
So what
And,
I say is,
yeah.
what's good for the heart is good down there.
Oh, okay.
So a healthy lifestyle will predict how long you will have potency, how long you can prolong your sex life, how long you can predict your ability to perform.
Yeah. And a while ago, you mentioned about comorbidities. Ibig sabihin, may concomitant illness, merong existing na mga sakit. Okay, I remember you mentioned about diabetes. You also mentioned about if there's a positive smoking history. So, ano ba yung mga ibang mga sakit, Doc, na kalimitan yun ang pwede maging sanhi? Bakit magkakaroon ng erectile dysfunction ng isang lalaki?
If you look at the comorbid that I mentioned, this is basically vascular.
Vascular
Kasi-
yung mga daanan ng dugo.
Correct.
Okay.
Because the penis is a vascular organ. It's not a muscle. So people think it's a muscle. No. It's like, yung panligo ng babae, yung lufa.
Yeah, yung
That is
magaspang.
that is the structure of the penis inside. It's like a web of...
Butas-butas, hindi siya isang solid
exactly.
particle. Isang solid
So,
material.
the flow, which is good, will fill up these spaces and maintain rigidity. Provided walang ibang sakit na maglilik yung dugo, lalambot agad.
I see.
See?
Okay, but however, apart from dun sa sakit, meron ba mga ibang gamot na pwede makapagpahina dito kung kaya hindi
Yes.
rin nakakapagpatayo?
Yes. So the common drugs you use for hypertension, cholesterol, and other cardiac drugs can also loosen your potency. So ito mga additive. The first thing that we try to tell the patient is lifestyle change. Lose weight, correct your cholesterol, triglyceride, sugar, all these things, no? Improve your sleep habits, remove too much or excessive alcohol, smoking, because all this can impede blood flow to the penis, no? Ngayon, the drugs that will treat you muna will also affect you. Like the
Strange.
cholesterol-lowering
Yeah.
drugs, hypertension drugs, etc., etc. They can cause also a form of erectile dysfunction
So basically, meron na ang problema, this can even aggravate for a while.
for a while. Yes.
So habang ginagamot yon, so talagang medyo magiging patient muna. So
Correct.
patience is a virtue. However, so does it mean na reversible naman po after ng management?
Yeah.
Okay.
Ang siguro mahirap i-reverse those people who underwent surgery. Like colorectal procedures, prostate surgery, that is radical, extensive, basta pelvic surgery na nagalaw yung nerves mo, medyo mahirap yan. No?
Kasi na
So,
mag-i-innervate.
these are the hard-to-treat patients na simple oral drugs may not work.
I see. How about, Doc, yung mga psychological factors or
That's a
may
very
mga
good
emotional
question.
issues ba that can contribute to
Yes.
to a male individual?
Yes,
in
that's
having
very good,
this?
no? Because psychogenic erectile dysfunction are abound. No? Lalo ngayon, maraming may mental health, lalo sa younger age group. Yan ang common issues na napapansin namin. But they're the easiest to treat. They're the easiest to treat. Kasi ito, sudden ito eh. Ang psychogenic, yung mga chronic, yung matagalan, ito yung lifestyle. Ito yung comorbids. Matagal. Pero yung psychogenic, mabilis yan, abrupt, and madaling matapos. For example, recent death of a partner, o kaya divorce, or marital discord, whatever, or any trouble in the family, hihina yan. Magkakaroon ka ng problem. So this is abrupt, short course, as compared to those who are drinking, smoking, obese, hypertensive, etc., etc., ay talagang chronic yan. At saka yung symptoms niya, hindi sudden, dahan-dahan. Bababa hanggang wala na.
So basically, just any other medical condition, dapat talaga ma-direct natin yung management towards yung sa cause.
Correct.
Okay, so
Correct.
whatever it is.
As far as reversibility is concerned. You know?
Yeah. Okay, so sorry that I have to ask this, no? Of course, di ba kasi we've been talking about yung male and female partners, but we should always also consider yung mga nasa ibang klase ng relationship. Pag ba, like same, like male gender, nangyayari, nakaka-encounter din kayo ng ganitong mga pasyente, Doc?
Yes, we still encounter this, especially dun sa age, medyo age na although you should remember, yung sexual encounters nila are quite different from the
norm.
opposite sex, no? Pag same sex kasi, there is more manual stimulation eh. Oral, manual, or even maybe anal, no? And, as men age, or habang tumatanda ang tao, ang lalaki, they prefer manual stimulation eh, rather than vaginal intercourse. For several reasons, no? Kasi alam mo yung vagina, after a while, lumuluwag.
Yeah.
Nagiging madulas, etc., nawawala yung sensation. While manual and oral are typically controlled. So some people really develop or have better experiences having the manual or oral sex.
So that's why, in fairness naman sa mga males who have this kind of condition, hindi lang naman palang sole factor yun sa kanila lang eh. Kung baga nagkakaroon ng ganitong condition. Okay,
Correct.
so kailangan, but of course, diba, syempre, we cannot really go into details, for obvious reason here in the show, but it's basically, kailangan talaga partners ang magtutulungan just so para makatulong dito po ma-improve ang condition.
And that's the reason why I appreciate the partner or the wife or the woman being in the clinic. Kasi I can explain that you cannot take the drug and watch it grow. Something like that, no? Unlike when you were younger, when your wife or your partner undresses in front of you, you have a hard-on. As it gets older, no. You have to do direct manual stimulation. You have to stimulate. You have to work on it. It's a project.
And sometimes it's still of no avail.
Yeah. So there's a reason why we sometimes do rehabilitation to promote better oxygenation of the organ before we go for full blast
So kung
treatment.
maganda, Doc, yan, na pag-usapan natin yung management later on, that's really interesting, okay? And, mga kasambay ito, mas nagiging interesting po ang ating pinag-uusapan, okay? And, ito marami talagang matutulungan ng mga couples, marami din pong affected ng ganitong kondisyon, no? Kaya wag muna ko yung BBTO dahil magbabalik po ang Doctors on TV. Welcome back mga kasambahay! At bago po tayo magpatuloy sa ating talakayan, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/UNTV News and Rescue na kung maaari nyo din pong balik-balikan mga kasambahay ang mga episodes po ng Doctors on TV sa aming Facebook page at YouTube channel. Ako kaya after liking and subscribing, pakishare nyo na din po sa inyong mga friends and family dahil napakahalaga po ng pagkakaroon ng awareness tungkol sa kalusugan. At para po sa ating pagpapatuloy, ngayon naman ay pag-uusapan natin yung mga diagnostic measures saka po yung mga treatment options para po sa erectile dysfunction. At syempre kasama pa rin natin si Dr. Jaime Songco, a urologist from Makati Medical Center. Okay, so this time around, Doc, no? So, upon coming sa clinic ninyo and of course, siguro sana having established your practice already, I'm sure alam niyo na kung ito somehow yung concern, ano? And how do you come up with a confirmatory diagnosis of erectile dysfunction?
Actually, that question is quite extensive in nature and can be very simple, no? I gave you the grading kanina,
Yeah.
grade 1, 2, 3, 4, wherein even the wife can give whether pasado o bagsak
Her
ang asawa
diagnosis.
niya. Yes.
Yeah.
But if you really want to go by, the classic type of doing it, one is go through the IESS or yung International Symptom Scoring, where you grade the patient. There's a form that we follow. And the more diagnostic ones would be the duplex scan. Kinukunan ng ultrasound yung penile artery in terms of blockage or it's like the duplex scan for the lower extremities.
Actually, a while ago you mentioned about na ang problema na ito is about vascular, yung
Yes.
pinakadaanan. So you have to check the patency.
We check for patency or obstructive level or if there is any. And sometimes, if you have the active ingredient, which is the prostaglandin, we inject that and repeat the duplex scan with the effect of the drug. Kung magdadilate and everything, if you can produce erection or what. That's another form
So
that
do you
can
inject that diretso sa mga sa blood
penis.
vessel?
Diretso sa penis.
Sa penis mismo.
Yeah.
And kung responsive, that's a good sign?
That's a good sign. Normally, it should respond in 15 minutes and it should work for an hour.
But how common is it sa mga pasyente po na may erectile dysfunction na non-responsive dito sa gamot?
Marami, lalo na yung mga na-opera. Like me, I'm a urologic oncologist, so I do a lot of cancer surgeries. Yun ang pinakamahirap gamutin. Yung mga nag-undergo ng cancer surgery, kasi nagalaw yung nerves eh. So it's not a matter of blood supply alone. You still have to contend with the sympathetic activity ng nerves to determine whether potency is really working or not. No? Kasi yung sensation is markedly diminished. So, it can be mechanical though, but walang feeling. So those are things that you have to consider. No? And also the severely diabetics na talagang hampered ng blood supply. So, ito yung mga talagang hirap-hirap gamutin. Na even the oral drugs that you've been used to be using regularly don't work.
Pero Doc, kasi di ba ang hirap din talaga mag-manage, especially if, alam mo naman sa Philippine setting minsan malala na talaga yung condition talaga bago dadating. So just, and it holds true with diabetes mellitus also, no?
Correct.
Sobrang taas. So, does it mean, di ba sabi natin kanina kasi, reversible naman supposedly, but we have to address yung ating treatment towards dun sa sakit, and in this case, erectile dysfunction. So, kung ang contributing factor would be diabetes, it has to be dapat maayos, ma-manage
Maayos yun.
yung, pero hanggat di naayos, mahirapan tayo.
Mahirap. Weight loss, diabetes, control hypertension, all this will have a factor.
So, it's gonna be a matter of acceptance na lang pag nagkaroon.
We still will work on it. That's why there's the term penile rehabilitation. We put them on a daily dose, low dose or medium dose for at least 30 to 45 days.
So, paano pupunta sa clinic?
Hindi, may gamot. Inumin niya araw-araw.
Ay, inumin. How about yung kanina sabi nyo, yung stimulatory injection? So, how...
That's another one. If kung nag-fail yung oral rehabilitation technique, then you can go to the injectables.
Oh, okay. So, kasi dito madidetermine kung yung mga gamot na ipe-prescribe will be working.
Will be working. Kasi kung hindi, sayang ang pera. The drugs are not cheap.
Yeah. Pero yung kamusta yung success rate natin dito sa mga management? Kung kunyari ma-address na naman ng I mean, on the side, minamanage din yung pinaka-problema bakit nagkaroon ng erectile dysfunction.
Well, marami naman nagre-respond, no? But in my experience, the hard to treat ones are, yun na nga, they're not improving their blood picture, they're not improving their lifestyle, or those who underwent really radical procedures, mahirap gamutin yan.
Mahirap.
So you really have to revert to other techniques, injectables, or even the worst case scenario, prosthesis.
So, okay, and yun, the last that you mentioned, so paano yung ginagawang ganong procedure, Doc?
The injections that I mentioned, prostaglandin is the active ingredient of these drugs. There are several in the market, although a lot of them are not available locally, but you can import them. No? Some ICUs in the country have prostaglandin, so you can mix your own concoction and inject the patient like with the use of the insulin
Syringe.
needles. That's why hindi man painful.
Kasi maliit lang po,
Maliliit
ano?
na maliliit yun. And then lastly, kung talagang hindi kaya, you use the prosthesis, yung nilalagay sa loob ng penis.
Para, kaya lang, Doc, kung nakalagay yun doon, si forever, nakatayo na siya.
Well, there are several types in the market. The most common is the malleable. Yung malleable meaning, binabaluktot mo lang, kang gagamitin, hindi mo gagamitin. Pag gagamitin mo, itatayo mo lang. But it's forever rigid.
Oh.
Okay? But, you know,
How about the sensation? Hindi ba parang nagsasuffer naman yung feelings ng lalaki?
Actually,
Sensation,
they're the same naman, no? But you have the more complicated ones, the inflatables, no? Where there's a pump. Pag pinump yun, mapupuno ng water, liquid, titigas, may reservoir siya nakatago. So, yun yung mga more complicated ones. But they're very expensive, no? So,
I can just imagine.
yeah, so these are the last resort.
Oh, okay. Naku, dapat pala ma-prevent na lang talaga magkaroon ng erectile dysfunction.
Yes.
Mga preventive measures, Doc. What can you share sa ating mga viewers when it comes to prevention?
Be healthy.
That's simple.
That's simple, no? So, kasi whether you like it or not, aging will come and your hormone levels will decline. Your ability to perform will be dependent on your healthy physical structure, your chemical structure, your muscle, your everything. It's all intertwined.
Yeah. You mentioned about hormones, no, Doc? Say, for example, a particular patient, wala siya nung mga ibang problema. Like, ayun nga, walang diabetes, wala naman mga bisyo, okay? So, and siguro because of aging also, and we know that there's a marked decline in the levels of male hormones, no?
Yes.
So, kapag ganito, this is actually preventable kasi yung pag-age, that's inevitable.
Yes.
But you can always go to your doctor,
Yeah.
like sa urologist, and tapos siguro if there's a need for a how do I say that, co-management with an endocrinologist, na Doc. And usually, anong age to papasok dito na, syempre, maraming na alarm ang mga kalalakihan ngayon na ayaw nila magkaroon ng ganitong condition, of course. Kasi, na-mention na natin na yung challenge po sa management, diba?
Yes.
Okay, so, how young dapat sila magpakita sa isang doctor? Kahit walang problema, just for a wellness checkup.
Normally kasi we advise a checkup routinely of most of your lower parts at age 50.
At 50?
Yes. So, yung testosterone na sinasabi mo naman, madaling gamutin. There's a replacement, no? May injection, we supply you with a testosterone injectable, and it's good for 3 months. So, one injection, good for 3 months. Your hormone levels will go back to normal. Your drive, libido, and everything will go back to normal. Your muscle structure will not be atrophied or depleted.
Yeah, plus
So,
protected din yung health nila cardiovascular
Yes.
wise, no?
So
Yeah.
it's very important to put into picture the overall physical health of the male. That includes exercise or activity, proper diet and nutrition, regular sleep, and I think that is what makes the healthy person.
I see, how about counseling sa couples?
Alam mo, hindi popular sa atin yan unless there's a marital issue. Pero for ganyan, very rare that they'll go to psychiatrist to complain about, Of course, I know there are a few sex therapists in the country. I don't think I can name them here, but I know a few. I think they can address that. But as far as treating them organically, I don't know if they are allowed to, kasi most of them are psychologists lang So I don't know if they're allowed to really write prescriptions and
Yeah. And so at the end of the day, it's really talaga you have to come and see your doctor, especially
Yeah.
yung mga urologists. So, for correct diagnosis and management.
Yes.
Okay, naku, Doc, thank you very much we were able to discuss this, no? So maganda yung pagkakalatag yun ng mga information para mas maintindihan ng ating mga pasyente, ang ating mga pasyente may erectile dysfunction. Kaya naku, wag po tayong mahihiya sa ating mga doktor pag kailangan ng tulong.
Yeah.
Tayo ay magpunta po't magpakonsulta. Nandito naman ang mga doktor para tumulong sa inyo. So this time around, Doc, baka may gusto kayong batiin, family or friends, or any announcement po. Yeah.
What can I announce? Now, Makati Medical Center now has the latest Da Vinci robot, XI, at we can be performing robotic procedures now in Makati Med.
That sounds great. Talagang ito na kasi ang technology ngayon, Doc. And of course, ang Makati Med, hindi magpapahuli. Okay, and you might want to promote our website here dito sa Makati Med.
Well, the website of Makati Med is always open to the public, so you can view the services, the latest activities that we have, especially in my department where I sit as a chair of the Department of Surgery. So please be welcome and visit whatever we can offer you. Different specialties of the department.
Yes, and again, you might want to visit www.makatimed.net.ph. And of course, apart from Dr. Songko, you can see there yung roster ng kanilang magagaling na lineup of practitioners here at Makati Medical Center. Thank you once again, Dr. Jaime Songko, a urologist from Makati Med.
Salamat po. Salamat for inviting.
Yeah, we hope mga kasambahay, marami po kayong natutunan sa mga naging paliwanag ng ating panauhin na si Dr. Jaime Songko. Maaari ito ay paulit-ulit namin pinapaalala ng mga tinatalakay po natin dito sa ating programa ay magsilbing guide sa inyo to embrace a healthy lifestyle. We consistently emphasize prioritizing your health for a good life. And with that, para po sa ibang mga tips o impormasyon mga kasambahay, ibabahagi namin yan sa pagbabalik po ng Doctors on TV. For some other details, mga kasambahay, dako naman tayo sa mga tips na maaaring makatulong sa problema ng inyong kalusugan. Let us learn the natural ways that can also help people with erectile dysfunction. For the details, let's watch this.
Magandang umaga sa inyong lahat mga kasambahay. Today, pag-uusapan natin ng isang health condition na na-encounter ng mga kalalakihan, lalo na mga nagkakaedad na. Ito ay ang erectile dysfunction or ED. Tara, pag-usapan natin paano ba natin matutulungan ng mga taong nakakaranas nito. Okay? So now, pag-usapan natin ng erectile dysfunction. Anong causes niyan? Pag ikaw ay may edad na, kuya, pwede, ha? Or, kung ikaw ay may diabetes, mataas ang sugar level mo, or mataas ang iyong blood pressure. Hindi lang yan kung mataas ang iyong bad cholesterol. Okay? Yan, pwede kang magkaroon ng ED. Right? Hindi lang yan. Ito, health conditions. Ngayon, pag may erectile dysfunction, tatlong klase yan. May mild, moderate, severe. Okay? Yung mild, pwedeng mangyari sa mga medyo bata pa. Bakit may ED yung bata? Pwedeng pagod ka. Oo. Pagpagod, tulog lang. Kung mild naman, pwedeng, tumataasan ng konti ang iyong blood sugar level. So, check up. Punta sa iyong diabetologist, ha? Kailangan may gamot. Tita Doc, para naman kung severe na yung erectile dysfunction, wala na. So, kailangan ay, habang yan ay mild pa lang, check up na at meron pong gamot yan, ha? Alam niyo po, mga kasambahay, pwede kang magkaroon ng erectile dysfunction kung may problema ka sa prostate gland mo, kuya. Ikaw lang ang meron yan, di babae, ha? Okay. So, ano mangyayari sa prostate gland? Remember, the prostate gland helps with the ejaculation of the man, especially when you make love, okay? Now, kung kompleto naman, tama naman yung bilang ng sperm mo, pero hindi naman maayos yung iyong prostate gland, ala rin, hindi ba? Sa importante itong tinatawag na male reproductive system from the testis going up to your prostate gland and out to your penis, dapat healthy. Okay? So, paano na? Ano dapat ang kainin? Okay? So, simple lamang. Pwede kang kumain ng, tanong nila, ano bang maganda? Yung matamis, maalat? Ano? Hindi. Kailangan lots of walnuts, watermelon, pati dark chocolate, okay po yan. Ha? Garlic, salmon. Sardinas kaya, Tita Doc? Pwede. Mackerel. Okay? Kape, pwede rin, pero once or twice a day lamang. Tsaa, pwede din yan. Citrus fruits, okay din. Dark, leafy, green vegetables, yan ang importante. Yan ang laklaking yung kainin nyo everyday, ha? Blueberries, well, Tita Do, kung naman blueberries sa Pilipinas. Okay, any berries, strawberries, pwede? Pwede. Mga herbs, okay, very important. Nutraceutical products, herbs po yan. Pwede po yan, ha? Sana, mga kasambahay, ay may natutunan kayo sa mga bagay na diniscuss ko sa inyo, ha? Ang mga ganitong health issues ay hindi dapat pinagsasawalang bahala dahil maaari itong makaapekto sa inyong overall health. Okay? Don't forget to follow me on my social media, Facebook, YouTube, Instagram, and TikTok. And for natural tips, stay tuned dahil natural or natural is beautiful only here at Naturally Yours. Okay? Thank you.
And with that, mga kasambahay, we conclude our today's enlightening episode. At ang lagi po namin dasal sa lahat ng mga may pinagdadaanan, lalo na po sa kanilang mga kalusugan, may God bring healing and guidance to each one of you, mga kasambahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Retina basically is the inner lining of the eye. No? Yung kung ang mata natin parang basketball, hati mo yung basketball, yung nasa loob niya, yun yung pinaka-retina. Kumbaga sa camera, yun yung film ng camera natin. No? That's the light-sensitive material that allows us to see. No? So ang nangyayari nga, yung nakadikit ng retina sa likod ng mata mo, na ano siya, humihiwalay siya o napipigtas siya or napupunit at humihiwalay dun sa likod mo. Kaya tawag dun detachment. Kumbaga, yung wallpaper sa dingding mo na pupunit, no, or humihiwalay.
Samantala ngayong linggo ay ang National Organ and Blood Donation Awareness Week. And this is under the Proclamation number 185 na idineklara po noong May 31, 1993 sa pangunguna po ni dating Pangulong Fidel V. Ramos. Ito ay ginugunita tuwing huling linggo ng buwan ng Hunyo. At ito ay ang pagpapahalaga at mabigyan ng kamalayan ng ating mga kababayan na ang pagdodonate ng organ at dugo ay kinakailangan ng ating bansa. Kaya't saludo po kami sa lahat ng mga nakakapag-donate para sa buhay ng iba. Maraming salamat po sa inyo. At yan po mga kasambayang aabangan natin sa susunod na linggo. And as we conclude today's episode, we want to express our heartfelt gratitude to all our viewers for their steadfast support. Your continued dedication to our show has been the driving force behind our success, and we are deeply grateful for it. We hope to continue earning your trust and loyalty. Thank you from the bottom of our hearts. And I would like to greet Kuya Daniel Razon na wala pong sawang sumusuporta sa mga adhikaing serbisyo publiko. At syempre, BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. And syempre, binabati rin natin si VP Nolly, VP Bong, VP Joseph, VP Jerry, Doctors on TV Production Team, Public Service Department, KDR Group of Companies, and binabati ko rin po ang aking kambal, si USCEA, hi kay EJ, kay Doc Alain, sa mga pasyente po natin sa Barbacabodil Health and Wellness Center. And of course, binabati ko rin po yung mga taga-Delicates Food Corporation headed by Mr. Jonathan Mooney. And of course, nanay and tatay, I love and miss you both very much. At sa ating pong mga kasambahay, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sara Barbacabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang umaga at maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barbacabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at Grand Floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barbaca Bodil Health and Wellness Center, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barbaca Bodil would like to express her gratitude to Medical Depot, healthy num-num food. Where we go.